thought you broke the chair then.
I was going to say,
No,
it's
that's my,
always a bit ominous when you hear a
leg.
sound when you sit down.
No, it's just my bones. They just like to
All right, no worries.
Lovely. Kieran, thank you so much for joining us on our podcast
No worries.
today.
Happy to be here.
Would you like to quickly introduce yourself?
Yeah, sure.
And who you are?
So my name's Kieran. I'm from Western Hospice Care. I'm the Community Engagement Manager for Western Hospice. Obviously, in our name, it says Western Hospice. It means that's where we're based. It's not just the area that we serve. We operate across North Somerset and into Somerset, which is where we are today as well. About 20% of our service area is down in Somerset and the other 80% up in North Somerset. People often assume that we just operate in Western, which is one of the negatives to our name, but the positives being we're not named after a saint, which a lot of hospices are, which means we avoid those religious connotations as we're open to every creed, religion, race of every person. We're here for everyone, so we avoid that connotation.
How far do you go up in Somerset?
So we operate all the way up to the north of Clevedon. So our area is dictated by the GP surgeries in our area. Our area kind of expands from the GP surgeries that are covered. So I'll use Clevedon Medical Centre as a good example up in Clevedon. And we also operate out of Sunnyside in Clevedon as well. So there are 2 GP surgeries in Clevedon. So the areas that those surgeries cover dictates what our area is. Obviously down here in Somerset, we've got Symphony North, which was the recent merging between Burnham and Highbridge, Brent Area Medical Centre, Wedmore.
Cheddar, kind of,
yeah. And our area in Somerset is based off of those GP surgeries as well. So we don't say we will go to Wells because we don't operate out of a GP surgery in Wells. They would come under St Margaret's, which is down in Taunton. So we have to keep up to date with where our GP surgeries operate themselves as their boundaries change. Keeping up to date with their figures and stuff as well. Sometimes we do support people out of our area. You know, it's on a case-by-case basis. If we've got someone who is, let's say, living in Portishead, they would usually come under St Peter's in Bristol. But if most of their family, let's say, live in Weston-super-Mare, and obviously driving from Western every time you want to go see someone, that's going to be quite difficult, and it might not be what's suitable for that family, in which case we could offer them to come under our care in Western, which would make things easier for their family, which obviously means they're more social and emotional support for that person under our care as well.
So do you want to explain what a hospice is? And also another question that I've got is, do you do community work as a hospice as well? So I'll let you.
So a hospice is a specialist palliative care support service. We are all hospices in the UK are charities primarily. No one that I know of, you might need to fact check that, are 100% funded by the NHS. The majority of us do get NHS support to a certain level. Then the charity side takes up the majority. So speaking for Western Hospice Care specifically, we get 18% of our funding from the NHS. The other 82% we have to find ourselves, be that through retail, fundraising, donations, gifts in wills, things like that. And what a hospice does is provide a supplementary service alongside our hospitals, GP surgeries, where we have specialist knowledge in palliative care. And palliative is one of those medical words that we use a lot. And what that means is just supporting end-of-life care when there isn't any curative treatment available, where someone isn't going to get better. But what we can do is make that time as comfortable, as happy, and as much about life and living as we can do. And that comes in a wide variety of ways. That can be our nurses going out and supporting people at home with specific care about their illness and getting things under control. That can be people coming into our day centre and spending a day with us once a week for a 12-week programme, being able to socialise, sit down and have a free-course meal with other people. Various forms of entertainment. I mean, just the other week I was running around being a fake bookkeeper. We were doing horse racing. Last week we had a Western Hospice Care talent show where a lot of our staff were going in, showing off their talents for the benefit of our patients and those under our care, and providing some light in their weeks to get out the house and come away. It's quite an exhausting day for people, but it's something really good to get out and do. Other things are, of course, our inpatient unit, which is where people come and stay with us at the hospice. We have 10 beds. Currently, we only have 8, though, because 2 of them are currently closed for some refurbishment, which we're very keen to see. So, brand spanking new rooms, which people are going to be able to enjoy when that work is done. And that means people can come in. It can be for the end of their life when, unfortunately, they're coming in and then they are dying with us in the hospice, hopefully supported by their loved ones, but with our doctors, our nurses, spiritual care, bereavement care, the wide range of services we have. For a lot of people, though, they come into our inpatient unit to actually get pain under control, symptoms under control, for some quite intense emotional well-being, before we look at discharging them either to a nursing home or back to the comfort of their own home. And we just get things under control for them. One of the common misconceptions is hospice is this, I use the term like a white clinical room, where there's someone in a bed very poorly and they're dying and everyone's very upset around them. Now, that can happen, almost comatose, unconscious, with their family around them. But more often than not, it's a place where we're interacting with that person. We're getting to know them on a really human level. And we're providing that care for them. And then the hope is we can get them to where they need to be that at home, be that to a nursing home, be that where they would like to be at the end of their life. And that's where they're going. And now that inpatient unit is a very small part of what we do.
Yeah.
We've also got complementary therapies, both for family and for people under our care. We have counsellors, we have spiritual care with our chaplain and their support team. We have, as I touched on, our nurses going out. We have companions, who's my volunteer team that I manage to go out and provide social support for people as well. And that's what hospice does. It does a lot. And we help manage various different projects across Somerset and North Somerset as well, involving ourselves in programs such as Aging Well, or hearing the voices through lived experience of those groups that perhaps are lesser heard, which is a project we're working on at the moment, and forging connections out there in the community for the benefit of our community as well. I ran away with that first question. Forgot what the second question was.
The second question was,
Andy.
do you actually go to people's homes?
We do,
and
yes.
support people dying in their own homes if that's what they wish to do?
So there is a very specific service called Hospice at Home. That's not a service we're able to provide at Western Hospice Care. But our community nurses go out and spend a lot of time in people's homes, specifically focusing on their palliative illness. So not their care, but their illness and what's causing them to be in this situation. And we liaise with other organisations to make sure that that care is coordinated and everything is put in place for. We have our physio, we have our occupational therapist. These are 2 very specific, specialised roles that go out and support people, particularly our occupational therapist, which is around beds and mobility in people's homes. Our physio is about managing your symptoms well. It's quite different to what we traditionally think of as a physio, about getting a joint working better or muscle groups. It's palliative physio, which is about to maintain health for as long as possible. And if Rosemary's hearing this, I've probably described that really wrong. I apologise, but that's my description of it. It's just that wraparound care and making sure where people are is where they're comfortable. And a lot more people are choosing to be at home nowadays. The majority of people under our care are at home. Wherever that home may be, a house, a nursing home, is a wide variety.
So how do people actually get referred to the hospice in any way, if you see what I'm saying?
Yeah. So hospices, hospices, I'll talk about Western Hospice. Most of our referrals come from GPs themselves.
Right. So it's direct from the GP.
It's direct from a GP, but we can receive referrals from any other healthcare organisations. We've got a referral form that people can fill out and use. That tends to be signed off by the GP because they've got the in-depth knowledge of what someone's symptoms are, their needs are, what specifically we can do as a hospice to help people as well. It might be that their condition, let's say they've got lung cancer, is very well controlled at this time. That person's emotions and spiritual distress is in a really bad place. that's something we can support with. You might not need any active help on your condition right now. We can help you in other ways, and you can start to get to know us, to build that trust up as well, which is going to be really important when that intense help and support is needed in the future. Trust comes a long way with that. So yeah, that builds up in people's homes, that builds across a wide range of services. I'm going off on a bit of a tangent here and I've lost what the question was.
Well, the only reason I asked that question was because, and I was talking to somebody about this the other day, when my nan passed away, she lived in London at the time. And she wanted to see myself before she went. And I remember we drove up there and they said she hasn't spoken for 2 or 3 days. Okay. And when we got in there was these lovely people that were in there kind of just looking after her every need. If you see, she was going to die in the imminent future. And it was just a lovely moment because as a lay person, somebody who doesn't have a clue what to do when somebody's dying, and lots of people don't have that understanding of, and don't necessarily want to witness that either. It was nice to see that the family that were there, my uncles and nieces and nephews and stuff like that were there, that they actually had a professional person there. And it was so helpful, and they were such lovely people. And I'm assuming that they were coming from the hospice. I kind of figured out by their dress code that they were. But I just thought it was a brilliant idea that people can die in their own home and be comfortable and be able to support the family at the same time.
Yeah, and it's really important that people are given that choice as well. You know, these illnesses that people get, no matter if they're a cancer, a neurological condition, a failure of an organ or whatever else, they strip you of choice. They strip you of decisions you're allowed to make. And being able to choose where you die is one of the choices you actually have. And it's really important. It's really powerful to give someone that choice. And for us working in this area of health and social care, it's a real privilege to be alongside people at the end of their lives, be that 6 months before, in those final weeks, or even in those final days and hours. And they're really touching moments that we have the benefit of having that privilege to be a part of. And it's deeply moving. It's deeply important. And it's the right thing to be doing, that people aren't alone and they're as well supported as they can be. And the trouble is, it costs a lot to do this. And one of the problems is that hospices up and down the country are currently facing is that we can't keep up. National insurance rises, NHS pay awards, living wage increases, these all have an impact on hospices up and down the country. And despite how well we are supported at Western Hospice Care by everyone across our region and the reputation we have as an organisation, we can't keep up. Just this past year, our retail, which is all of our charity shops, and our fundraising team have exceeded their targets. They've done absolutely brilliantly. To use an example, we've had our Men's March, which is our annual event of a 10-mile hike for the men under our care. So anyone can take part in this hike, but it's in the memory and support of someone. We've had our highest ever number of sign-ups for that event this year. We've also had our highest ever amount of fundraising coming in from that event. And that doesn't help. It does help us, but it doesn't keep up with those exceeding costs, which year on year get worse and worse. And obviously global events play into those costs as well. And it has an effect on us, and it puts us in some very, very difficult situations as a charity. And people have less to give these days. Cost of living year on year affects everyone.
Yeah, but people put their money in different places, don't they? So, you know, they'll have a specific, like we're a charity as well, and we're in the same boat as you. Yeah. But, I mean, we don't have the biggest expenses that you guys have, but we're all in the same situation, aren't we? Trying to raise money, and you're asking people to dip into their pockets and bring that money out and give it to us. And people will choose which charities they want to do that with. And I'm assuming you've got people who leave you things in legacies and and it's just been quite a quiet year on the legacies and gifts and wills front. There's nothing more that our teams could have done in that area. It's just been people would like to leave more to their families to support their future generations.
Of course,
absolutely. And you know, one of the biggest ways that people can support us is by letting their MPs know. You know, hospices across the country need more support. the amount of relief that we provide to the NHS up and down the country is extraordinary.
Yeah.
And yet we don't have fair funding from the government for the amount of relief we provide. In fact, giving us a bit more support to give us that sustainability maintains that cost saving for the NHS.
Yeah,
in
it's
the
crazy,
long run.
isn't it? We're in the same boat, Kieran, because we've talked about...
we're exactly the same. We are a mental health counselling charity that gets referrals from GPs, from the NHS, from the mental health services. We don't receive any social care. We don't receive any statutory funding, and it's very, very difficult when we have to go out there and fundraise for every penny, and we're very grateful to the donors and the grants that we get awarded, and all the volunteers and everyone, as I'm sure your organisation and lots of other similar organisations do. But there does get a point where you sort of sit there and go, hang on a minute, we are saving these statutory services an absolute fortune. We can do it cheaper as well, typically, because our costs and volunteers and so on. Why can't they help us a bit more? I totally get it, and we're all in the same boat, really.
So do you have volunteers? Do you have, how does that...
Got a considerable amount of volunteers.
I know you've got lots in the shops, and in fact, one of our trustees is volunteers in one of the shops, isn't she? She's a regular volunteer there.
Again, if Victoria is hearing this, who's our volunteer manager, she might correct me. I think we're around about 400 volunteers across our organisation, which is more than twice the amount of actual staff we have in the organisation as well. We wouldn't be able to do what we do without our volunteers. We have our celebration event for our volunteers every year, and the amount of long service awards we continually give out to those that have been with our organisation for 10, 20, and in some cases 30 years supporting us.
That's amazing.
It's brilliant. I can speak specifically about my team, the companion volunteers that go out and provide social support. We've had some of these volunteers doing it for years, and a lot of them got involved through personal experience with the hospice when they've suffered their own bereavements and just wanting to give something back. And there's so many wonderful success stories with those volunteers about things they've done to support someone else, or they've done an excellent piece of volunteering that's really made a difference to someone else's day. And it's people wanting to give back to their community. And the goodwill of these volunteers saves us as an organisation so much money as well, because they're doing this out of the kindness of their hearts. One of the most powerful things that someone can do is give their time. They might not be a doctor or a nurse, but they're wanting to be there to support someone purely out of the kindness of their heart. And that's really, really powerful. And for the person, again, say if it was a bereavement volunteer, if that person's having some emotional support from a volunteer, that person sitting there knows that that person's not getting paid, that person is there purely for them in that moment. And that's really warming, that's really powerful.
It really is. It makes a massive difference to people.
Absolutely.
How many people do you think that Western Hospice support a year?
So, I've recently done some statistics and data trawling. I'll pick these numbers off the top of my head from what I can remember.
I don't know.
So we cover a population of 212,000 people. That's excluding people who aren't registered with GP surgeries, because we don't have that data. And at the moment, we're around 420 people supported across all of our services. So that's people with conditions at the end of their life. That's also family. In some times, really close friends. That's how many people we support. The breakdown of that figure I don't have off the top of my head, but we mainly support more patients than family. And that has increased quite considerably year on year. Overall, we're supporting 11% more people than we were last year. And in that figure, the patients has shot up quite dramatically as well.
Is that because you don't have the funds to support families, or is it that people are on their own?
A variety of factors. So the patients has gone up quite considerably because we've expanded our services in certain areas. So we've got a hospice advice line now,
right,
where we can have patients under our care just for advice rather than in-depth care. So those figures count towards our provision. Our physio and our occupational therapist run 2 groups called fatigue and breathlessness, which is support for people with fatigue and breathlessness from a wide variety of conditions. And that's a 4-week group that runs. Those people count towards our statistics, and they might not be supported out in the community by one of our nurses at this time, but it might be an early introduction to hospice care. The other one being our neurological support group for people with things like MND, where they can come in and get that same type of early support before we move on later. And so there's various patient support services we're providing which up those numbers. In terms of our families, we're constantly operating at a high capacity caseload on our bereavement, our children's counselling, our spiritual care, our companionship support. You know, we're doing everything we can, and we always try and take more people on when we have that capacity as well. But it's also that we're getting out there more as a hospice. We're trying to feed into our wider areas. We're here down talking in Somerset today that people don't often know we operate in these areas, and spreading that word that we're here to support you, and find out more can go a long way as well.
And I think that's really important, because I know, like, say you go to Musgrove, because like we go to Musgrove Hospital in this area, as well as going to Western Hospital, and there is nothing down in Taunton Hospital that promotes your hospice. And we had a situation where a friend died, and it was quite sad, and there was like, because I know Western Hospice and I know quite a few people in Western Hospice, it felt that there's a divide really between one hospice and another hospice, and so therefore people kind of fall in between that gap.
They can do.
And people don't know what's out there for them, so therefore they don't actually, because you don't think about a hospice until you're dying or one of your relatives are dying. And
Absolutely.
I think we lack education in our communities to know what a hospice can do. And I know that you are the experts when it comes to medication with pain, rather than somebody on a ward that might not ordinarily experience somebody dying on their ward. And so therefore you have that knowledge. You're experts in dying. It sounds an awful thing to say, but you are.
Someone needs to be.
Exactly. And it's very difficult to watch somebody who's dying not get the care that you know the hospice would give to them. And part of that is because they haven't got a clue what a hospice is.
Absolutely, yeah. And so there's various initiatives we do, Dying Matters Week coming up in May, for example, where we'll have a stall down at Musgrove to start spreading the word a bit down there. Yeah. Some more, not just to the public, but also to professionals. If the doctors, consultants, GPs that operate around Taunton, Bridgewater know about what we can do. So if someone in Musgrove is providing care to someone who lives in Burnham-on-Sea, and they diagnose them with a palliative condition, knowing that that person's got a choice. Do you want to come down to Taunton, to St Margaret's, or would Western be better for you? Giving people that choice is going to be really important. So
but also you need to know what it's for.
Absolutely, yeah. And stuff like that is about making sure our information is up to date on our website. We're going through a website renewal at the moment to make sure we're going to get everything up to date. We operate get-to-know us sessions, which are essentially open days at the hospice. I say open days, they're a few hours. One of which we have after our recording here today.
But how would you get people there? I'm sorry to interrupt you, but how do you get people to come to an open day at a hospice when they don't even know what a hospice is? Do you understand what I'm saying? Yeah. Because there's a level of ignorance. I don't mean that disrespectful to any of the audience that are watching this, but people actually don't know what the hospice is, as I say, until they've got somebody that's dying. And they might be told about the hospice at the hospital, but they won't necessarily been told.
Absolutely. And that's one of the important things of operating sessions like this, is they're not just there for patients. They are there for people who fundraise for us to see where their money's going. They're open to professionals. They're open to patients and family members, of course, but they're also open to the public, anyone that just wants to find out a bit more. So in my role, when I go out and meet people, that can be various different things, you know, the North Sedgemoor Neighbourhood Forum. It could be going out and meeting a community organisation, bringing leaflets with me to distribute and promote these events so that people can just come along and go, oh, I didn't know that about hospice. Yeah. Now I do. And we gather feedback at these sessions, and always people are a bit more anxious before they come. And when they come in, they've had a Q&A, lots of sugar, lots of cake, lots of tea and coffee, had a tour around, met some of our staff. We win people over. And we almost start to get rid of that taboo of what dying and hospice is, because for a lot of people, that is still a very taboo subject. You don't talk about death.
But we're all going to die.
We're all going to die. You can't avoid it. And also, you know, the language around death and dying does suck, and it can put a lot. It's a part of life. And, you know, we're not saying embrace it with open arms. It's still a very emotional and, you know, deeply troubling subject for quite some people, particularly if they've experienced some quite traumatic deaths in the past where care hasn't been provided in the right way. But coming in and just taking that edge off things can really ease people into understanding what hospice is, so that if they need that in the future, they already have a little bit of an understanding ahead of time. So it's not this big daunting thing you have when you get a diagnosis or when your treatment hasn't done its job and sadly you're given that news that it is going to end your life. If we can start getting ahead of that, we can start having conversations about death earlier.
Do you go into schools, just out of interest?
Not at the moment, we don't.
Because that would be a brilliant way to educate.
We don't have the capacity for that at the moment. Obviously, I've touched on our funding, which does mean, you know, staffing hours are as close as they can be. But yeah, starting to talk about these things better. If we were using schools as an example, so educating staff on how they can help support children. You know, children aren't immune to it. Their grandparents will die. Sometimes their parents or their caregivers will be given a diagnosis, and that child will be bereaved in schools. Our children's and young persons counsellor, Liz, she does go into schools, not for like big presentations, assemblies, but she provides support to the children in these schools. And she has done training with staff, particularly at primary schools, on what they can do to support children as well. So we do it when we can, but focusing on the patients and families under our care is our first priority. That sort of stuff is secondary, and we wish we could do more of it. If we had more funding, more hours, more staff, we're restricted by those costs at the moment.
Luckily, we pick up the pieces for that. Yeah, we do as a charity. So we do an awful lot of children's counselling. A lot of, I mean, we do everybody, all ages, but we do a lot of kids, and a lot of kids that have had lost a parent. And I think sometimes there's a level of ignorance in the community as to how that will impact on a child's behaviour in school and how they can become distressed or angry or whatever. And then there's sadly, the schools act in a punitive way to that child, and they then end up in either being excluded or whatever. But actually, it's all because mummy or daddy's passed away, and they're
and you know, I was a teacher before I came into healthcare, and there was a big movement before about adverse childhood experiences, and you know, bereavement is one of those areas. And if that's not dealt with appropriately, that child not supported, and as you said, dealt with in punitive measures, you can really develop that adverse experience, which is going to follow that child throughout the rest of their lives. And so providing that support around that child is really important, not just from us as a hospice, but all the different organisations involved, be that schools, other support services, scouting and guides, anyone who has interaction with that child. It's really important to support them. And different hospices do support in different ways. If we talk about, I believe it's called St. Michael's in Hastings as an example, we met some of our colleagues there last year. When their hospice was set up, part of their foundation was providing bereavement support to the entire area, not just in palliative care. Anyone who is bereaved, they would support as their hospice. It's something they still do today. They've got lots of employees and lots of volunteers that support bereavement across the area of Hastings, because that's how their hospice was set up. And our hospice grew from this little community nursing outlet before becoming a little bedded unit up on the hill in Western, to then growing into Jackson Barstow House in Uphill now. And we're much more focused on the providing care. We do provide that bereavement support, but we can't keep it.
You can only do what you can do, can't you?
We can only do what we can do, absolutely. And we always wish we could do more.
Yeah. Well, we're in the same boat. I mean, you always think at the end of we got through another year and we survived, and now we're in our next year and we're going to go forward. But you have that concern forever. And the last thing you want to do is you look at it and you think, gosh, we've got like 100, I think we've got about 120 on the books at the moment. We've got about 120 people on the books, and you think, I'd hate to have to tell all those 120 people that, sorry, we don't exist anymore. And I'm sure you guys feel the same every year as well.
If we talk about both our organisations as well, it's if one or both our organisations were ever to not be here, who would pick up
exactly
that? And what would the cost of that be, particularly to the NHS? Investing in organisations like ours saves money down the line. It saves it long term. The NHS new plan of neighbourhood working is all about preventative measures we can do out there in the community. Yeah. And organisations like ours are already doing a lot of that, and having more central and fairer funding is really going to push that for organisations.
Well, we hope it does, but they've been talking about this for a long time. I've been in the mental health career. It's been my career for the last 40 years, and it comes in, it goes out, that conversation, it comes and goes, and then nothing ever changes, really, sadly.
It's always the way, isn't it?
Yeah.
Question, you've also talked a lot about supporting patients, but also supporting families and things like that. What about staff? How do you kind of support staff? Because they, everybody experiences bereavement, grief, and all the things connected to it. But your staff are experiencing it probably in an almost daily, certainly weekly basis. Yeah. How are they supported?
Yeah, so for some staff, they're quite new to it, quite emotional. It's not something you get used to over time. It's always going to be hard watching someone at the end of their life, being with someone when they die, and supporting the family, the friends after that time as well. But our clinicians are supported. They have, I forgot the word for it now, supervision. There we go, drawing a blank today. They have supervision where they're able to support and unload those emotions. Our volunteers have that supervision with their managers as well. As an organisation, we have staff feedback on what we can do better with our own wellbeing support group. We have a new wellbeing microsite that's being set up for our staff to access different resources and support in different ways. And it's also that camaraderie of we're all in this same boat. We're all providing this care to our community. Get your arm around someone, talk to them about what's affecting you, because they might have gone through something similar. We have daily meetings where we discuss patient caseloads, difficult situations, get advice off the other professionals in the room, so that we can try and avoid problems when they come up. And naturally in this work, there's going to be emotional conversations. There's going to be tough conversations. There's going to be days where someone is really struggling, and we have to look after each other. If we can't look after each other, how can we look after the people in our community?
True. Yeah.
And I completely concur with you. And as you know, I
must
run
have that
in the rehab as well. It's, and we've had a really difficult year, actually, probably a bit longer. And trying to support the staff, we do exactly what you do. We have a debrief every morning. We check in with each other every morning. We then have another debrief at lunchtime, because you don't know what's happened in the morning that might have come up. We then have a debrief at the end of the afternoon, and then we have another debrief at the end of the working day for all the staff to come in. And it makes such a difference to people's well-being. I mean, we don't have any sick at work, apart from those that are dying, sadly. But, that is the thing. So when our staff are off and they're not there, they're very much missed, because people do not do sick at our place. But with the counselling team in the charity, we meet monthly. They have their own supervision. They have to have their own supervision. But also they've got myself and another colleague at the end of the phone if they need it every day. And I think it's so important to offer that to everybody. We were talking about a difficult situation this morning, weren't we? And it was like, I have to, if I make a decision about something in the charity, I want to run it past somebody to make sure that I am not being judgmental and not dealing in a negative manner to that person or whatever the circumstances are. So I can run that past any of the trustees and they will support me. But I think if you don't have that support, you don't have a team. And I think that's what's important, is to have a good, strong team behind you. And then you can, to be honest, that the thought of sitting there and watching somebody die, I've done it lots of times. I don't particularly like it, and it always leads me to tears. I hate it, but it is what it is. And people do die, and it's people that you love often die when you don't want them to, if you see what I'm saying. So
and I kind of touched on it earlier as well, Angie, is that, as you just said, you've been there with people. What a privilege that was, that you got to be that person with them at the final moments of someone's life, to make sure they were cared for, to make sure they were comfortable. You only get so many of those moments and they're really important.
And I think doing it right is important, because it's not only important to you, but it's also, I'm going to cry.
It's okay, Andrew.
It's important to everybody, isn't it? I think that's the important thing. And to families, to friends, everyone. And that's why, going back to the whole support piece around, it's not just supporting the families and the friends, it's supporting the people that are providing that care. You know, it is really difficult.
It is.
So, yeah.
It's an emotional topic, Angie.
It's okay. It's okay. So what, have you got any sort of exciting fundraising things that you've got planned for this year?
The biggest one coming up is our spring appeal.
Okay.
It's not something that's happened for quite a few years. It's a big fundraising push that we do once every few years. Obviously, times are tough at the moment, so now is the right time to do a spring appeal again, which is where our fundraising team is rallying behind the push. So it'll be on social media, there'll be letter drops, around our entire area, where we're really trying to push for some extra funding, getting more lottery sign-ups, more people to leave gifts in their wills, and to just really try and garner more support for us as an organisation. We're investing money in it to gain more money back. Yeah. And currently that's going really well. Okay. But we just got to keep pushing things, and there'll be an open day. I believe it'll be April the 11th, if that's a Saturday. I'm hoping it is, off the top of my head.
Well, this podcast will probably come out after that.
That's okay. It either went really well or it went really bad.
Or you got the date
went
wrong.
Really well. Or I got the date wrong. But fundraising team, they're doing everything they can possibly do to continue to push that. So we're hoping for a really good response, a response from our community as well. And of course, as more time goes on, we might find out more and more information from the government. Their response is going to be in April. 20 CEOs from hospices across the UK are meeting in Parliament to hand deliver a letter to the Prime Minister and then speak in the Houses of Parliament to MPs about the situation of hospices. Our CEO, Paul Winspear, is one of those CEOs going to that meeting as well. So we're hoping we can keep putting on that pressure to go, government, come on, support us. We're here providing care for the entire nation. Yeah. Help us out a bit more. We need that support.
Yeah, that makes a lot of sense.
Absolutely.
I think one of the things that's really difficult is that for many people, it's like, why do I want to raise money for something that I'm probably not going to use? Or why do I want to give money to something that, we'll die in hospital or whatever? But people don't see the difference between dying in a hospital and having the support before you die, or your family to have that support, and then actually dying in a hospice. It's a very, very different experience.
It is. And if you talk to anyone who's had an experience of hospice care, be that a family member or be that currently being supported, they'll always be the biggest advocate for what hospice care is. If you've ever had a really serious injury or illness and you've stayed in hospital yourself, you probably know that's not somewhere you would want to die, on a ward with 8 other beds around you, people yelling out in pain. It's not personal, it's not private. Hospice provides that privacy, it provides that personalised care, as well as being at home provides that as well, and that comfortability of being in your own environment. And I wouldn't say it is an alien thing to people. I'd say, it's quite natural to be where you're comfortable at the end of your life. And capturing people's stories and sharing those stories is always a really good way of doing that. And our communications team often share on social media different stories from people under our care. Our hospice film, which is available on YouTube and on our website, does a really good job of listening and interviewing different patients under our care. I remember the first time watching that myself, it was quite impactful. You know, watching these people speak, some of which have died, some of which are still under our care, and hearing their voices recorded talking about their experiences at the hospice are just so impactful. And that hospice film does an excellent job of showing what we do and where we are. And some of our current patients are staying in hospital for current reasons. And getting them into the hospice is sometimes what they want to do. If they don't want to go home, hospital is very often where people don't want to remain. Yeah. And that's no fault of the hospital staff at all. But a hospital, in my eyes, this isn't representing my organisation, but a hospital is a place for getting better. The staff that always want to make someone better. A hospice is a specialist unit where we know someone might not get better, or is highly unlikely to, or won't, if we're going to use that more direct language, where we can tailor our care around supporting that person and their family as empathetically, as holistically, and as wide-ranging as we can. And that's what hospice care is, and that's why it's so important.
Do you link with donors, like donor teams and stuff like that, or are people too...
Yeah, so one of the biggest projects we've done during my time at this organisation is we run an eye donation, a corneal donation project. Forgive me, I'm not clinical, I'm not medical, so I might get some things wrong here. I'm sure Dr. Fiona, our consultant, will tell me off if I get this wrong, but corneas are one of the few organs you can actually donate, even if you've got cancer or a neurological condition. If you die with a cancer or a neurological condition, you can still donate your corneas and give someone else the gift of sight. And that was a project we run for, I want to say 2 years. I might be wrong on that, where we were introducing the question of corneal donation to people under our care. And quite a few people actually said yes. You know, families might have felt a bit differently about that. Some might have been accepting, some might not have wanted that to happen. I can't speak for the specifics, but what it enabled us to do is to support that form of organ donation more than we could. Yeah. And a lot of people assumed, oh, I've got lung cancer, I've got liver cancer, I can't donate anything now. Even if they were a lifelong organ donor, giving them that chance to still help someone else can be really important, because off the top of my head, I believe corneas can support, it's more than just one person.
Yes, it is. Yeah.
It's quite a few. Do you know?
Yeah. Anyway, my son donated his, and so that's how we know it. And it's like helped lots of people gain their sight.
It might be up to 4 people.
Yes, I think it might be.
Quite considerable, really.
It's interesting because in a normal hospital, they automatically, if somebody's dying, they'll go, are you, you know, if they're not on the they're on the, even though the donor list no longer exists, they still check the donor list, don't they? And you don't realise that just a very small part of your heart can save 2 or 3 babies' lives. But until you actually have that conversation with somebody, you don't actually know.
Yeah. And we're in that really unique position as a hospice where we're already having very difficult conversations with people about some very emotionally charged subjects. Having a question in there about corneal donation isn't that much of a step further than some of the questions we're already asking people. And so, you know, my personal belief, again, not speaking for the organisation, is that that was such a good project to run. I don't know how many other hospices were involved in that, but it made a considerable difference to many people's lives up and down the country, from giving people the gift of sight back thanks to the kindness of someone donating their corneas. That's so important.
I think one of the things that I found very encouraging, we were at Southmead Hospital, is on the walls. I don't know if you've been to Southmead Hospital recently, but on the walls they have, somebody donated a heart for me and somebody donated this. I donated, even though they died after my death, I donated this. And it was, and I think sometimes just people don't know and they're fearful of asking the question, but having all of that evidence out there is, and it's a little bit like the hospice, people are fearful of asking the question, well, can you help me with my medication? I know that's something that you do. Somebody's got a problem with their medication, they don't know what to do. I know that you guys send people out to do that in their own home. Yeah. And I think some people you just don't know until you know, if that makes sense. And
which is why things like today, talking on your podcast, is really important to spread those messages more and more.
That's why I've been nagging you to come on.
You have been, and I'm glad I'm finally here. And hopefully I've not been too boring today. And we get more and different staff from the hospice coming in and
they're more than welcome.
We do as well from many different areas that can speak in much more detail than I can about specifics. If any of our staff are listening to this and I've talked about your department, I do apologise. I'm a generalist. I go over everything broadly.
So what made you personally go from being a teacher to working for a hospice?
For me, I loved what I did in teaching. I was an art teacher in secondary school. I was involved in education for 8 years, and it was just the right time to move on. I still love teaching children about something new, seeing them learn and develop, those relationships you build with staff, with students, seeing them succeed. You know, I still run into ex-students now. A lot of them now are of working age as well in their own little jobs.
Hello, sir.
It's funny how many names you remember as well. But it was just the right time to move on for me. I wanted to challenge myself and do something different. I knew that I wanted to still work in my local community. And I was searching for jobs for a while. Not actively searching, going, I need to get out, but seeing what's out there. And the job at the hospice came up, and it was just like, this sounds really interesting. I know of the hospice through my personal life and some significant figures in my local community that I knew that been through, and just how well regarded the hospice was held in such esteem as well. So I rang up, I spoke to John Bailey, who was our previous Director of Patient Services, said, I've seen the job advert, can I come in for a look around? And my first introduction was very, very unique. So I was introduced to Jan Wakefield, who was my predecessor. She runs our day services at this time. And on that day, I came in, found out more about the roles. It was really interesting. And this guy turned up in the car park with this big van. He'd been on the motorway for like 8 hours that day, I think, because this was at the end of the working day. And I went down with John Bailey to meet this guy. It turns out he was a Chris Martin tribute act. I think he was called Cold Place.
Okay.
And he travelled down from somewhere up north to come in and do a private concert for one of the patients that was on the inpatient unit at that time. And I believe the story was that this patient was admitted to our inpatient unit at the end of his life. He had some Coldplay tickets that he was sadly no longer going to be able to use. Various members of the hospice team had pulled together, got in contact with this guy, and he'd driven all this way to put on this private concert for this chap. We might have some videos and photos on our website of this, and he had this private concert with Coldplay in our little hospice garden on the inpatient unit. And I remember very distinctly, this guy arrived, he'd been stuck in traffic all day.
Bless him.
And John, our Director of Patient Services, went up and said, right, okay, what can we give you? You've been stuck all day. And the guy was like, no, don't want anything. And well, at least let us pay for your mileage. And the guy was going, no, I want to do this. And it was just one of those really touching moments that summarises what hospice care is all about. And for me, coming in, looking for, is this going to be the right place for me to apply for a job for? It won me over like that.
Really?
Got my application in, succeeded in the interview. Being in teaching, notice periods are considerably long. It was a 6-month waiting period to leave my job.
I bet you were in agony in that period, almost.
I wasn't, though.
No? Okay.
I loved the people I worked with. I, got to see that year's cohort finish their exams as well, see them get their results, which is always really warming. So don't miss any of that. Sorry, I do miss a lot of that stuff, but it wasn't hard, and then it was exciting to come into somewhere new as well, and also then still be working in the same communities that I was serving in secondary school education. Price Academy, that school, it serves the Bourneville area of Weston-super-Mare. Hospice, we're on the doorstep of the Bourneville, same community. Obviously, the hospice has a much wider reach, so I can have much more of a reach across our community as well, and get to meet people that are doing the same things, which is always good networking to do, and see what good is being done out there in our communities as well for the betterment of our people.
Do you have a stall on the emergency services thing at Burnham-on-Sea?
Not to my knowledge.
I just think you need to contact.
Okay.
I'm not sure who it is that still organises it. I know the guy that used to, Mike in the in the barbers used to organise it. That's how I know about it. But I certainly think it's something you should get on board with.
We, in our fundraising team, we have community fundraisers. So we have a community fundraiser dedicated to Burnham-on-Sea as well. So that's definitely something I can pass on.
Yeah. I can't remember when it is, but it's in the summertime, and it just is along the seafront, and we all just plod along and get in there and have a little tent and show off who you are. But I think it'd be a really nice thing, because I didn't think you were there actually. No. So you don't just do hospice. What do you do in your private life? I mean, do you have fun?
All sorts of things.
You've got to have fun.
Yeah, rugby's been a
Who
major.
Do you play for?
Major. So I played for Hornets in Western. You know, that's been a passion of mine since I was about 6 years old.
Yeah. How old are you?
32. So, 32. Not quite a veteran of sport yet, but I've done that all my life.
When is a veteran for rugby? I've got no idea.
I want to say.
No, really?
Yeah. So rugby's one of my greatest passions. Done that for as long as I can remember. Inherited that from my dad. My youngest brother plays as well. So rugby, a daughter at home, so handful with a toddler is a big part of my life at the moment. Me and my wife, we've got a renovation of a house that we're still working on 3 years later as well. So that takes up a lot of time. Art is always something I enjoy. And then, just going out and doing various things, taking an interest in everything you can in life, and always looking to learn as well. It's really important.
We had other people on the podcast that talk about what they do in their own personal life, but a lot of your stuff is very community based as well. If you're doing rugby, not only are you doing rugby, you're fundraising for the rugby club, and I'm assuming your daughter will probably go and play rugby, and it'll go on and on and
on. And those connections cross over into professional life as well. The rugby club, Western Rugby Club and Western Football Club and other sports clubs around our area do so much to support our work as a hospice as well. Whether that's community events like our Blue for You, where we get sports club and organisations to wear blue for a week in support of us, or Hornets very kindly offering us a venue to run some clinical training that our consultant Charlotte Field's going to be running in the next few months for professionals to learn more about palliative care. These organisations support us as an organisation, which then just breeds that community support across what we do. Obviously, Hornets themselves have connections to the hospice in some very personal ways through some club members that have died under the hospice. That connection is so strong right now. Not just through me as a member of that. Darren and our fundraising team, who's a Hornet and also one of our fundraisers. I spoke about John Bailey. So John Bailey's sons, Danny and Tommy, play for Hornets as well. And Miriam, his daughter, also plays for the ladies team. Pete Sloman, who's our finance director, involved in Western Rugby Club. And we've got this wide
it spreads,
range.
Doesn't it?
It does. And so getting people that are passionate about their local community into the organisation benefits the organisation, because they spread that word to their community groups as well.
It's funny you say that, because we've just been approached by somebody that wants us to be their charity of the year, because currently we were Burnham Harriers charity of the year, and somebody else has asked if they would like to. And it's really lovely that people want to get involved, isn't it? And that they're local, not celebrities, but they are in a sense in their position of what they hold, which is really, really nice. So in a year's time, where do you think you're going to be?
No idea. Everything's an open book. Obviously, we try to just keep having an impact on our community.
Yeah, of course.
See projects that we've started seeding start to fruit, and see where we can go with those. Like one of the projects I'm quite passionate about at the moment is it's called our Lesser Heard Voices project, which we're running in collaboration with Voluntary Action North Somerset. So it is a North Somerset focus, but it's focusing on the lesser heard voices about ageing. So when we say ageing, we say people in the age 60 to 70 plus category that are perhaps lesser heard. So our start of our project is focusing on the LGBTQ plus community, and particularly those that have received some institutional trauma in their lives, some of those that have experienced the criminality of being gay, being lesbian, being bisexual in their lives. And they're now entering a stage of their life where they might start having some more frequent trips to hospital. They might come under hospice care. They might have to enter a care home later in their life. And there's a lot of anxiety around that. And, you know, what can we do as a collective of professionals, from us as the hospice, the council, various organisations, do to support these people, hear what they're saying, create a positive response to that, and using the LGBT community as a starting point. Then how can we extend that to people with learning differences, neurodivergence, people who are perhaps immigrants or refugees? How can we support these different groups in accessing all of these brilliant systems we have set up in our local area, but also nationally, and really trying to make a difference?
But there is, and I'm going to be really controversial here, and Mike will tell me off, I know this, but there is that part where actually it's every person, isn't it? It is every person, because most people don't know and are not educated. Most people are not educated about the hospice. They're not educated about what's out there to support them and how to utilise that support in a positive manner. It doesn't matter what your diversity is or whether you're not diverse. You know, I'm never sure. I think we're all diverse because we're all individuals, but it's recognising that fundamentally it's just education that we all need about what the service is and what you can ask for, or just ask. We can always say yes or no. And if we can't, we might be able to guide you into a place that can.
Absolutely. And at the hospice, we're always welcome. We've got a info email address, which is info@westernhospicecare.org.uk. So people can always just email in questions. You can ring the hospice and our reception team will forward your call to someone who might be able to answer your concern. We've got a 24-hour advice line that people can ring into to get advice from a clinician. There's never any harm in asking. And if we can't help you, we will hopefully be able to point you in the direction of someone who can find the answer for you.
And I think that it's similar to us. We don't take people out of the Sedgemoor area, but there's always an exception to the rule, like you said about your chap. We may know somebody that can if we can't. And I think that's the bit, is about realising there are people that are informed and can help you in other ways. And I think that happens with all organisations, but people are a bit nervous about making that approach. But if the approach is open like yours is, I think, go for it.
Particularly with organisations like ours that are so embedded in the community as well, is the fact that you're building up that trust with people so they can just approach you. Anything, we might not be the right place, but we can point you in that right direction. And even just being helpful in that sense just takes the edge off things, particularly for us, for being end of life. You know, it's those slow introductions to what we do and just generating that trust and warmth.
For sure. Well, I think we've probably kept you for long enough, to be honest.
That's okay. Thank you for having me. It's flown by. I don't know how long we've been talking for.
No idea.
Just over an hour.
Really?
Yeah, just over an hour.
I thought your episodes were half an hour long.
But yeah, thanks very much for coming on.
No worries. Thank you for having me.
We'll have you back again soon, or certainly some of your colleagues.
Thank you.
Thank you.